I'm going to talk briefly about the Health Insurance Portability and Accountability Act, or what we otherwise know as HIPAA. I know that many of you have HIPAA compliance requirements, and there have been numerous questions that have come to us over the time about how the breach program interacts with your HIPAA requirements. And one thing that I would say is that really what you're doing with your breach program is helping you stay in compliance with HIPAA. HIPAA has several very interesting aspects to it, and unfortunately we've seen the regulations extend. The FTC has actually come out with additional regulations for companies that normally would not have fallen under HIPAA requirements, third-party vendors, etc. And in these situations, in the event that you have a breach of information, if you are doing a billing for a company who should be HIPAA compliant, if you have apps for a company that should be HIPAA compliant, if you have a company that does a program where you are putting some central place that a consumer can log on to a website, for example, and enter information about the medications that they take, or perhaps upload information that they obtain from their blood pressure cuff readings, you may find that you actually fall under the additional requirements. In many states, what we're seeing is a particularly onerous requirement, which is if you have a breach of personal health information that includes 500 people or more, you're not only required to notify the consumers and the Department of Health and Human Services, but you're also required to notify the media. And as time goes on and we see more and more breaches, what we're finding is that the regulations are getting more strenuous. Unfortunately, sometimes it's hard to tell if you actually fall under HIPAA compliance rules or if you fall under the FTC rules of notification. Bankers has put together a program that's a very comprehensive program for breach. And what this program does in one component is it actually looks at the requirements of breach notification, not only to the consumer that's included in the breach, but also to the other entities that need to be notified. And our job is to make sure that you stay in complete compliance and regulation with not only the notification requirements, but also your duties under HIPAA. So if you are a clinic, if you are a third-party vendor for any sort of medical information or billing or collections or storage and destruction of health information, it is really to your credit and to your best interest to look at the breach program. This is something that will help not only third-party vendors, but will help doctors, nurses, dentist office, anyone who maintains any information on consumer health. It will help you stay in compliance. It will help you avoid some very stringent and onerous regulatory fees and fines, and it will keep you able to focus on your business while the service absolutely takes care of all the notification requirements that you're required to comply with, as well as interact with the individual consumer and make sure that you retain the business that you have had traditionally and keep you from losing that business, which is really one of the core components. It's a part of your BOP policy. It is something that is very reasonable, and I think that you will find that it more than saves the cost of whatever the fee is that goes onto your BOP policy. If you are a medical provider or you are an entity that deals with consumer medical information, you really have no option, if you're going to protect your business, but to look at having a breach solution in place as mandated. Thank you.